Could you just briefly go through the current treatment of each of the main types of skin cancer that you've mentioned, and also how successful are they?
Of course, as we mentioned, an ounce of prevention is worth a pound of cure. So always the best that anyone can do is to prevent ultraviolet exposure and not have to undergo treatment. But once a skin cancer has developed, there are different stages in development of skin cancer. With squamous cell carcinoma, there's a stage called actinic keratosis, which is considered a precancer, in which there's usually it presents as scaly skin, which then can develop into squamous cell carcinoma of the skin if left untreated. That usually is treated with in various ways. There are creams, there are treatments with a certain kind of light called photodynamic therapy. Which is done in combination with a chemical that's applied to the skin. There are some lasers that are under investigation as well, and usually the treatment for those is non-surgical. If there's just a handful, we use cryotherapy. We'll spray them with liquid nitrogen, which is super cold, and that destroys the epidermis, which is the upper layer of the skin where those are found. Once we have a full-blown cancer, then, and certainly if it's invaded beyond the epidermis and gone into the dermis, the lower, the deeper layer of the skin, then the gold standard is to cut it out to do surgery. And when it's on certain parts of the body, on the face, on parts of the body where you want to keep as much skin as you can and not sacrifice any of it, then the gold standard for treatment is something called Mohs surgery.
That's your specialty.
Which is my special. Yeah.